The federal government has announced plans to ramp up the creation of medical supplies needed to fight the outbreak of COVID-19. Healthcare workers, we know, have said that they're worried they don't have enough supplies or equipment to treat the expected onslaught of patients with this virus. So the feds plan to ask manufacturers to retool their factories to create things like masks, sanitizer, and ventilators, or scale up production of those items. And companies that already make that equipment, as I mentioned, will be asked to scale up. Navdeep Bains is the Minister of Innovation, Science and Economic Development. Hi, Minister Bains. Thanks very much for making time for us.
Thanks very much for having me on, Vashi.
Minister, you're asking all Canadian industry and researchers which can retool or refocus to shift to contributing to the fight against coronavirus. Is there a limit in the scope of all that you announced today on the funding that the government will provide, or is there really no bottom to that fund?
What we've done immediately or in the short term is open up current programming that exists for innovation and industrial policy. So I highlighted, for example, the Strategic Innovation Fund for companies that want to scale up production, or Innovative Solutions Canada, which helps newer companies, innovative companies that have cool ideas for them to quickly commercialize. So rather than creating new programming, we've opened up all current programming to assist our efforts and really help these companies develop the equipment, the essential supplies that our healthcare system needs and our healthcare workers need.
Can I ask you, because I'm guessing that, I had to look up what a lot of these programs were, and I'm someone that pays a lot of attention to this. If I'm sitting at home right now and I'm wondering, well, what exactly does that mean for the level of preparedness this country and our healthcare system has for COVID-19? Can you provide me with some very practical examples of where you anticipate this announcement will help?
So what we're saying to businesses, and many of them already have reached us and contacted us and said they want to help. And many Canadians have done the same. So come to our website, share with us what you can do. Then what we'll do is we identify programs to quickly help them scale some of those ideas up or help start new production. And what we're saying is we've opened up all the programming to do this. 3 companies that we identified already that are working with us, one company in particular, Thornhill Medical, is building ventilators. So it's about how can we help them scale up their production to build more ventilators. Or Medicom as a company in Montreal, and they're focused on masks, N95 masks. How can they increase their production? Or the company here in Spartan, or in Ottawa, called Spartan, it's really focused on diagnostic testing for COVID-19 samples. So how can we quickly have that tool available for frontline workers at airports or clinics? So these are some of the examples that we're already engaged with in companies that we're working with to help build production and scale up production.
Can I circle back to the example you provided where ventilators are concerned? Dr. Theresa Tam said today that 550, I believe, ventilators are on order. In the U.S., there's a problem. They have a lot of ventilators, or they need a lot of ventilators, but they don't have that many respiratory therapists. Is that an issue here in Canada?
And that's exactly what Dr. Tam has told us this morning as well. It's not simply about ventilators, but also about having the support for that as well. And that's why we work very closely with the provinces and territories to identify their needs, both in equipment, supply, and human resources as well. And we're doing everything we can through procurement and our purchasing capabilities to address those needs. And what I've done today is say we're going to also mobilize our industrial capacity, our industrial footprint in Canada to really help with those efforts.
How will the government address the lack of human capacity then that you rightly pointed to Dr. Tam talking about earlier today? Will there be, for example, a relaxing of the licensing requirements around respiratory therapists?
Look, we have to examine all options. We don't want to compromise the health and well-being of Canadians, but we recognize these are extraordinary circumstances. These are very challenging times. The situation is very fluid. And if we have to adapt and make changes at the federal level to help our provincial and territorial counterparts deal with the number of cases that, by the way, are increasing still on a daily basis, if we have to make adjustments, we need to be nimble and flexible, do it in a more effective way, but also in a way that doesn't compromise the health and well-being of Canadians.
I want to ask you about a couple other things that your government has announced and that fall somewhat under your portfolio. The first is actually about some of the financial needs of both people and businesses. We've seen the airline industry take a huge hit. I had the president of Sunwing Airlines on yesterday. He anticipates that his industry will need at least some sort of bailout. Is your government prepared to do that?
This is not about one industry now, Vashi. This is about the entire economy. I can't think of any region or any sector that hasn't been impacted. So I can tell you right now, the GTAA, the Greater Toronto Airport Authority, is in my riding. And they are laying off thousands and thousands of people because of the fact that no one's flying and everyone's at home. So we recognize that we're going to have challenges right across the economy. And what we want to do is come forward with supports. We want to come forward with initiatives that help us transition through this crisis and enable those businesses to survive so they can employ Canadians. It's not only about protecting businesses, it's about making sure that they're in a position to rehire so we can quickly rebound after this crisis.
I understand, Minister, that of course this is having an impact on multiple sectors in the economy and of course many Canadians.
Yeah.
But that didn't answer my question directly. Is the federal government prepared to subsidize airlines to keep them running?
We're prepared to help every sector. We're prepared to help every region. So oil and gas, for example, is feeling a significant amount of difficulties these days, to put it mildly. You just talked about the airline industry. Transportation more broadly is impacted. Hospitality, for example. So there's example after example, and then that's the point I'm making, is that we're going to be there for all of them, because this is about businesses. They're struggling to keep the lights on, to pay the bills. They have no revenue. They're worried about their staff and employees, and we recognize that. But the first thing we did was provide immediate support to our healthcare system and to our world-class researchers. We followed that up with support and direct income support to Canadians who need money sooner rather than later. And we're going to follow that up now with support for businesses and industries. And that includes aviation, oil and gas. We're going to be thoughtful, and I'm going to work very closely with my colleague, Minister Marneau, and my other cabinet colleagues as we move forward to assist these different sectors in these different regions to transition through these challenging times.
When it comes to oil and gas, as you mentioned, I know a lot of people in Newfoundland and Labrador, as well as Alberta, are watching, very interested to see what the federal government might mean when they say they're going to help. I heard Finance Minister Bill Morneau earlier this week signal an upcoming investment in orphan wells. Will there be something beyond that next week?
Look, I don't want to preempt the work that the Minister of Finance is doing, but I can assure you and Canadians that we have the strongest balance sheet in the G7. We have the fiscal firepower and the capacity to assist our industries and to assist Canadian businesses and protect Canadian jobs in the short term and make sure that we reposition our economy to succeed after this crisis. And so we're going to examine every possible option. Orphan wells is one such initiative, but I suspect there'll be more endeavors and more initiatives to really help not only the oil and gas sector, but the entire economy.
And will those be coming next week?
Again, the timing of this really depends on the Minister of Finance and the work that he's currently doing with Seamus O'Regan and other cabinet colleagues. So there's no specific timeline that I have to share at this moment.
Okay, before I let you go, another big announcement from your government today concerns the U.S.-Canada border. And of course, that agreement comes into place that allows for some restrictions, mostly restrictions on travel between the two countries. Correct. Comes into place at midnight. But as part of that, the Prime Minister earlier announced that Canada would be turning back asylum seekers at the U.S. border. For years, when the opposition has asked your government to do so, you've argued that it would be out of step with international legal obligations. Is today not out of step with those obligations as well?
Look, these are extraordinary times. This is obviously a very difficult decision that we had to make. We still recognize that this decision is reciprocal in nature, that it's not only us, but the United States that's also pursuing a similar policy. The fundamental reason for us doing this, and I think it's important for Canadians to understand, we're all making enormous sacrifices. We recognize that this isn't something that we would proceed with in a normal course of action, but it's about preventing the flow of people. It's about saying we want to limit the activity people have. It's about staying home and social isolation and social distancing. So these are the reasons why we're taking such extraordinary measures, and I know how challenging this is for people to hear, but we're doing this because we want to protect the health and well-being of Canadians.
I know you said that it's reciprocal. Have there been border crossers going the other way, border crossers going into the United States that have been turned back to Canada or will be?
That's just to reflect the consistency in the policy. This is not designed to target any one community or one particular country. The idea behind this is to demonstrate that we have consistency and alignment in our policies.
Was it the Canadian federal government that asked the Americans to make this deal, or was it the other way around?
It was really a byproduct and a reflection of the conversations we had about how do we limit the flow of people going back and forth? How do we make sure that we focus on essential services, focus on goods, and to keep our supply chains up and running for medical purposes and for our food supply? And so in that context, we had this conversation.
But was it the Canadian government that instigated it?
I think both countries recognize this is something we needed to address, so we both mutually agreed upon moving forward in this manner.
Okay, I'll leave it there. Minister Bains, really appreciate your time this evening as always.
Thanks, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.